Infectious disease specialist Dr. Zain Chagla joins us this morning, again, to answer questions about the latest developments of COVID-19 and vaccine updates. Good morning. Happy Friday.
Hi.
Happy Friday, because we're talking vaccines on this, December 4th. When was the first time, I want to ask you, when did you first see literature on COVID?
Yeah, I saw the first case reports in an email on New Year's Eve, but there was some great literature apparently documented, in early December in Chinese media of something going on. So, it's almost a year anniversary from the first reports of it.
Isn't that stunning that we're talking vaccines this morning?
Yeah, it's a
Just
year,
about ready.
right? It's an entire year. Like, it's a year from the first talk of this virus in humanity to, in the UK, they're rolling up their sleeves next week. It's medical progress is incredible, right?
This is a moonshot.
Yeah, this is a game changer, right? Like, this is, it's hope for future pandemics. Should we ever get there? We know that we have models to actually get this scaled up in such short amount of time that, there's protection. It's not to say we're never going to suffer from something like this again, but there are tools if it does happen.
Right. Because normally, it was like 5 years expected for a typical vaccine.
Yeah, exactly.
Yeah.
And what happened in 1918 was everyone caught it, right? Like, unfortunately, that was it. There was death and destruction because of it.
So having said that, and of course, Pfizer first out of the gate, and they've already shipped to the UK, but they just announced last night they have some logistical problems. The supply chain, they're actually cutting it back to a half of the supply that they originally thought they could ship in 2021. How much of a setback do you think that's going to be for us?
Yeah, I mean, we probably won't get as much as quickly. I think, between this and Moderna, who's also applying, who's about 2 weeks behind, I think we will get a reasonable supply, though, in 2021. It'll take a little bit more time. Let's just say that. But I think we're ready for it when it does come. And so be it. Between Pfizer and Moderna, they're both fairly similar in terms of efficacy. If one gets here, then that's still something more than nothing.
Yeah, the Ontario government is officially announcing its task force today. And among them, a bioethicist. Let's say that bioethicist is named Dr. Zain Chagla. The rollout, what kind of order would you like to see?
Yeah, I think there's two core populations in all the global rollouts that have been really declared. And so long-term care residents, and that is really just saying, who is at the top of the list of dying from this? And we all know that is a fact. And the people taking care of them. So that, I think, would be the number one. And then you start working out after that. And I think, the UK did a really good job of just doing age percentiles. So those over 80, it's very hard to make up that you're over 80. And so it's pretty standardized, and healthcare workers. And then just going back year to year. And then kind of when you get to the 70 point, start talking about chronic medical conditions being incorporated at that point, and then the general population after that. So I think, that everyone has some fairly consistent signals of that long-term care sector really being the first sector to get the vaccine, and rightfully so. On paper, they're the ones that have suffered the most.
Yeah. Now, it may not be as much of an issue in Canada, but mind you, it's important that this pandemic, for Canada's sake, ends globally. Vaccine resistance. The WHO has raised some flags about this, and we have seen some concerning surveys in the U.S. about people not wanting to take the vaccine. How much of a problem, how concerned are you about that?
Yeah, I mean, so there's resistance. There's true people that say they will never take a vaccine. And I think they're hard to reach. And unfortunately, there's firm and fixed beliefs that really are difficult to deal with, even with positive and evidence-based literature. But there's a pretty equal chunk of people that are hesitant. And the reasons for being hesitant aren't unreasonable. This is a new vaccine. It's really never been seen in humanity before. There's only 6 months of data behind it. I think they have reasonable questions. And even that, we've only seen the data by press release, although the UK government has seen enough data to say it's safe enough to administer the entire population. I think it's really reaching that population, being transparent, honest, and open. And hopefully they're the ones that are probably not the vocal ones, but the majority of all of these in that sense, that they, with some information, some encouragement, some relationships with their care providers, get to the point where they're able to accept the vaccine, The other part being is, it's not going to be a mandatory thing. It's still a regulated medical product. Everyone has to give the consent to get it.
Yeah.
But
Now,
your entry,
we're just about out of time, but should it be mandatory? Your thoughts on that?
it's a medical product. At the end of the day, it's not perfectly safe. And so you have to make it not mandatory.
Yeah.
But tying it into going to school, working in a hospital, traveling, those are things we can easily do to make sure that it's pretty universal that you need this to enter into society.
Okay. Hey, thanks so much again. Have a great weekend. We'll talk to you again next week. Infectious disease specialist, Dr. Zain Chagla.